Hello, I'm Dr. Amy Moon. I'm here to talk to you about Votiva by InMode. And specifically, I'd like to talk a little bit more about this wand called FormaV. So, what does this wand do? Why do we have it? Why am I so excited about it? Well, I'm excited about it because it continues to give women another option in their sexual health, and as well as just the overall look of their vaginal tissue as it changes over time. So a lot of the women I take care of suffer from different kinds of medical conditions that FormaV can be really helpful for. The most common one is probably postmenopausal women who suffer from atrophic vaginitis. That's a condition where the cells lose their collagen and they lose their elasticity, causing dryness, itching. It can cause reduced lubrication and pain with intercourse. Traditionally, we've given women different forms of estrogen therapies in the forms of creams or tablets. There are certain medical conditions that make that contraindicated. It can also be messy, bothersome, inconvenient. The cost can be expensive. And also, for some women, they just don't work. So there hasn't been a lot of improvement in those areas recently. But we're excited to have this option available for women. So exactly how does this work? These plates produce a radio frequency heat, and when applied with a gel and treated over a treatment area, they force the tissue to recollagenise. As the tissue recollagenizes, it will get thicker and more elastic and produce more lubrication, which is exactly what we want in that part of our bodies. This treatment is done both onto the inside of the vagina and the outside, just at the portions of the labia minora, clitoral hood, and perineum. It's 10 minutes per treatment session, and it gets slid inside only to the distance of your body, and then it's brought back out in a circular motion. So we're just going to be going in and out, in and out. It's very gentle, it's very soft. It also just feels warm but not painful. The tolerability level is amazing. The results can also be quite quick. Some of the other areas that FormaV can be helpful in is in stress urinary incontinence. Because the vaginal opening can become larger and more open with having children, helping that tissue become smaller and more firm can hold the bladder neck up. This can prevent stress urinary incontinence. So this treatment can be done 3 times, 1 month apart, and the results should last people for many years. If the results begin to feel like they're not working any longer, a single treatment can bring you back up to that baseline that you were before, and you shouldn't need to do additional 3 treatments in the future, if you need any at all. The last reason, and the third reason that the FormaV can be so helpful, is it can relax the pelvic floor muscles. It can help treat areas that have been torn or damaged by childbirth. So if women are having a lot of pain with intercourse due to scar tissue or tight muscles, a condition that we call vulvodynia or dyspareunia, this can also help make the tissue more elastic and stretch, and it can reduce the pain down dramatically. So because it has 3 separate indications, there are many women who could benefit from this in all different age groups.